It was clear over 20 years ago that there were a lot of guidelines being produced, but a lot of people weren't necessarily following the guidelines. And so work had gone into the guidelines to try and give practitioners an idea about what best practice was. And if people aren't doing it, then you're saying, well, that's really not up, the care is not up to scratch. And so by putting together a set of guidelines around implementation, it was going to allow us to sort of be more optimistic that GPs would get there. This is the third edition of the Green Book, and it's been reassuring to see that even though there's been very little publicity about the book for quite some years since the last edition, the amount of downloads per year has actually remained fairly consistent. And so it says that it's a resource that seems to be useful to practitioners. Most of the principles contained in the Green Book also relate to chronic disease management and other areas of care in terms of how do you get high level of coverage around the guidelines for things like diabetes or asthma or the like.
So what's new in this Green Book is that it's a lot more engaging and interactive than previously. We've made a real effort to involve all of the team members in a general practice and to get their contributions to a really implementable approach to prevention. So when you open it up, you're going to find the evidence about how to put prevention into practice, but also a step-by-step approach to doing that with lots of interesting case studies and examples. So what we can learn from the Green Book is actually how to put prevention into practice. We have fantastic evidence-based guidelines like the Red Book that the college has produced, but the Green Book sits side by side with the Red Book as an approach to implementing prevention in practice. So the Green Book has been created to give us a really comprehensive approach, a pathway and resources to help not only GPs but the whole practice team. In order for prevention to be successful, we've got to involve every single member of the general practice team. So that includes practice managers, reception staff, practice nurses, registrars, GPs, all working together with the common aim of implementing prevention. And it was a real privilege for me as chair of the working group to work with representatives from all of those team members.